Don't be afraid. It may be intimidating at first, right? I would say if this is, something that you want to do and you want to put your mind to, you can do it.
Welcome back to the Spero Mental podcast, where we take storytelling to a whole new level by sharing amazing patient stories, interview experts in the community, and share resources for clinicians and students. So today we have the amazing Maegan Barin. Hey, Maegan.
Hey.
And Maegan is one of our amazing co-workers at Spero Rehab. She's an occupational therapist. And so thanks for being with us, Maegan, today.
Of course. Thanks for having me.
Yes. So can you start by telling us a little bit about yourself, where you're from, what do you do for a living, and what do you do for fun?
Yes. Okay. So I was born in San Antonio, raised there, moved here to Katy when I was in 6th grade, and pretty much just lived here all my life. So as far as what I do for a living, I'm an OT. And I have been doing this now for 4 years. And as far as for fun, I have a husband who I've been married to for 3 years as well. And we have a 2-year-old son who definitely keeps us on our toes and makes things interesting.
Aww. Any hobbies whenever you're not working or not spending time with your family?
Yes. So I love to watch movies. That's one of my favorite things. We love to go to the park with our little one. And we also, I am a huge reality TV fan. So that's probably where I kind of digress after a long day's work, and just kind of mindless drama TV is I love.
I love it. I'm reality TV girl too, so I gotta love it. Did you always know you wanted to be an occupational therapist?
No. So I actually had never heard about an OT and what it was. Obviously, I knew what a physical therapist was, but all growing up, I actually wanted to do something in special education, right? And I always gravitated towards kiddos who have disabilities. And that's where I spent ever since I was in 3rd grade. That's where I would spend my recesses inside of a special ed room. Just hanging out. So when I was a junior in college, I was kind of just trying to, figure out life and where it was going to head. And my mother at the time was staffing for PTs, SLPs, and OTs. And so she went exploring, and she saw it, and she was like, you know what, you should, look into it. So I contacted a outpatient pediatric clinic at the time in San Antonio while I was in school, and sat in on one session, and I was like, this is exactly what I would love to do. Of course, I knew it was going to take a little bit longer to do school, but it was super worth it. So yeah.
Oh, I love that. And so since you've been out of school, what settings have you worked in?
I have worked in pediatric, outpatient neuro. I've worked in a little bit of home health, and now because of COVID, I've actually done a little bit of home health telehealth on the side, and where I'm at now at Spero, and that's outpatient neuro / ortho.
Nice. Do you have, in those settings that you've worked with, do you have a favorite patient population that you enjoy working with?
So I definitely have, my heart is for sure with the peds. I love pediatric patients. So a little bit more background on me. So in 2014, I was a tech at a pediatric outpatient clinic. And then this was prior to me getting into school. And then I went and I started teching at Spero. My mom actually, whenever she was a recruiter, we lived very close to Spero. And so she had came over and started, she found them and told me about them. And then I went and interviewed. Everything went great. Loved it. And I still had no idea neuro OT even existed. And so since then, I had a therapist that was working at the time, and she just completely took me under her wing and loved all of the things that she, showed me. And so now I love adult neuro as well.
Oh, I love that. So for those who are
Mhm.
not like very familiar with the outpatient neuro setting, can you talk a little bit about like in a day to day, like what kind of like patient diagnosis do you see?
Okay. Yeah. So I typically see spinal cord injury. I see cerebral palsy. We see stroke, we see MS, we see CIDP.
Yes, yeah.
And yeah, yeah, that's all I can think of. There's some rare ones that are in there that I can't remember the exact name, but yeah.
Yeah, it's definitely like I love how you listed all of those because I think you're right. Like we see such a wide variety and such a mix of different neurological conditions. So yes, something that I really appreciate, like whenever I watch you treat or even like talk to you, is how in your treatment sessions you incorporate some of the psychosocial components of like battling an illness. Like, can you talk a little bit more like about that?
Yes, so as far as OT, I feel like that's a huge scope. Well, I mean, I feel like it's a huge scope with all the disciplines, right? But the way that we incorporate it, I think it's super super emphasized in our treatments, and I think that the way that I always go about it is, they've gone through this traumatic injury, right? And because it is the adult population, I feel like it is typically something that has gone from completely independent prior to now we're battling and trying to get back to where we were. So I think that with that being said, they obviously go through a lot of anxiety, depression, and all of the things, right? So I think that them just kind of having this safe space and being able just to trust us and to really talk to us, I think that sometimes that means us being super open about our lives and where we've been through and even difficult times that you can just kind of relate. But also at the same time, never, whatever they're going through, not just putting them down, right? I think that always giving them that opportunity, just to kind of
To like
spill it,
share,
right?
yes, yeah,
Yes,
share and
yes, yes,
express, yes.
yes, 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 just to express everything. So, with that, I think that that opens up a huge opportunity for them just to go in and um, uh, trust us as
Yeah.
clinicians, right? And I think that with time that helps. And um, yeah.
Do you feel like your ability to like have this conversation is like something that you're like is kind of like more innate or like natural, or do you feel like it's something that you had to like work on?
So I think that with certain patients, it's a little bit natural, and it depends on the personality. I think that some people are super easygoing and will have, will be able to connect, right, on a lot of things.
Mm-hmm.
But there are also some people that, just kind of shut down, and it's hard just to kind of, dig deeper. But also, I think that by me reading them and knowing that they just kind of need their space, and they'll eventually slowly give in just a little bit. Um, I wouldn't say that it comes natural, but I think that with experience, it's gotten a little bit easier um, to really have some of those conversations, or even hear them really just tell their story and express those emotions, because I know that that's incredibly tough for them.
Nice. I yeah, it's like yeah, I like how you mentioned how like, it is like you bring it back to how it is such a tough moment for them, like for them to be in rehab, because they've been through something really hard. I find it really interesting how like the different professions work together, and how like one of the things that sets like OT really apart is like that mental health like piece. And I know some occupational therapists like specifically work in mental health settings.
Hmm.
So in
Hmm.
the outpatient setting, like you bring in this conversation, what are some ways in which you address kind of like mental health with your patients? Is it via like more like interventions, or is it more like talk therapy in a way?
Yeah, so it again, that kind of depends depending on the patient, right? Some people actually respond a little bit better to, I had a student recently that was with me, and she definitely kind of targeted more of depression and how it happened following having either a spinal cord injury or significant pain, right? And I think that with having her, it really helped because she would, provide them these questionnaires, right? And I think that, well, for instance, the Beck Depression Scale is super important, right? So I think giving them that, seeing where they're at, sometimes, again, so it's catering to the individual. Sometimes it's just chit-chatting with them, and or sometimes it's like giving them a little bit of homework and figuring out what works best for them. Maybe it be a little bit of meditation, whether it be discussing something with their caregiver and or spouse at home to really have those deep conversations that maybe they've avoided the entire time, right? Because I think that throughout the caregiver and it's not only, whatever happened to the patient, but also the caregivers going through it a little bit as well, if not just as much, depending on the situation. But so I think that figuring out, what works just right for the patient will help, as well as, of course, utilizing some cognitive behavioral therapy, which is just, trying to give a little refraining, their thoughts and their negative thoughts into positive ones, right? So giving them and showing them that they've shown progress and or giving them that motivation, right? So whether it be telling them, hey, we did a good job, or hey, we've been here and now look at where we're at, and showing. I like to really remember what we have utilized in some interventions. I do remember, with a specific patient that I had, let's say we were really struggling in something that's targeting trunk control, right? And or weight bearing, and then waiting a couple of weeks, right? If it was really tough and kind of frustrating, then we obviously don't want to sit there, and we want to challenge them, but again, just right challenge. So I think that then maybe giving that a break for a couple of weeks and then going back and trying again, and then just being like, hey, look at the progress. A couple of weeks ago, we weren't able to actually do this. So now we are. And I think that maybe giving them a little bit of that feedback really helps.
I like that. And I love the example that you gave too. Another topic I also see you address with your patients is like sexual relationships and how some of those things can be changed, like following traumatic injuries, especially like spinal cord injuries. So for like listeners that are not as familiar with those diagnoses, can you talk a little bit about how something like a spinal cord injury can affect like your ability to engage in like physical intimacy with your partner?
Yeah. Of course. So definitely one of my favorite topics and super important topic at that. Again, intimacy is extremely important, and it also doesn't mean that you have it actually the physical act of having sex, right? It could be that, but also just being intimate with our partner is going to be completely different than where we were before, especially if I'm talking more specific to spinal cord injury. I think that with spinal cord injury, with males specifically, I know that I work a lot with males. There is obviously some points I'll target as far as for females, but it can be change in sensation, ability to achieve orgasm, the ability to maintain an erection, right? So I think that within the OT scope, I think that by allowing them, or actually to provide them with the correct resources. So I think my main thing whenever I first start discussing that, I think is usually at evaluation. And it's just more of, hey, we go through all of our normal ADLs, right? And I think that it's an IADL that covers right there. And I just kind of say, hey, I know that, we're just meeting, but I also want to just throw this out there. This is within our scope. So if there's ever anything that you want to discuss involving this area, please let me know. Sometimes they're really open and they'll just start sharing all of the things right there and then. And or sometimes it's just, completely all right. And it's just not their time, which is completely respectable, right? Again, I think that's where the rapport, kind of comes into play. But I think that by educating them, first urologist is a good piece of reference first and foremost, and then also just kind of there's educating on, let's say if it's erections, right? I think there's three different types as far as for males goes, and not there's three different types, but there's three things that involves having that, right? And there's more psychogenic, reflexogenic, and spontaneous nocturnal. It's kind of one of the other ones, but as far as for psychogenic, that includes more of like the sounds, the smells, the sights, the thoughts that can increase more of that arousal. That typically is for psychogenic erections, that's usually located at T11 and below. So let's say if we have an injury above that level, then they're not getting as much of that signal to the brain, right? So I think that by educating them on, going home with their spouse / caregiver, whoever it may be, their person that they're in a relationship with, tapping into those things and really trying to figure out what really can get us aroused, right? In different ways, whether again, it may be sounds, certain smells, certain things. And like I said, it may just be just to like kiss one another again, right? And to just kind of find that time within each other. Again, I think that this whole topic is usually talked about when we do have that trust. But as far as for reflexogenic, that usually targets more of like the physical touch or the stimulation. So ability to like reflexively get an erection. And it's usually in the lowest part of the spinal cord, S2, 3, and 4. And reflex erections are from usual touch is most possibly in T2, T10 or above. Again, I think that with these things that I'm stating, it does not mean everyone is different, right? It could be that, you may have sensation in certain areas. I think by tapping into those areas and really figuring out what really works for you guys, because I think that just by sitting there and stating, hey, I'm a C2, C3, and I'm never going to get this back, that's never the case. So just kind of giving them that knowledge. And I think that I've found that in outpatient, whenever I've started talking about these things with these patients, they've actually been really, really receptive and actually really confused on the fact that no one has highlighted this or even emphasized this. So that's been, kind of tough, but I get it. In acute care, there's and inpatient, there's so many other things and avenues, right, that they're trying to address prior to discharge. But I still think it's super beneficial, right? Again, I guess that's more of, being able to get to know your patient and what's super important to them. Because this may be at the top of their list, and then we've got to address it. And sometimes, and I'm sure sometimes this is the main thing, with some of our patients we get back to, and we've got to do it. We've got to figure it out, right?
Yeah.
Yes.
I love that you're addressing that. And so you answered the question I was going to ask, which is like, whenever you're having this conversation, like, do you find yourself being the first person, like, even like addressing that topic? And it's crazy that like you are, because we are in outpatient, we're like the last line. And I understand there's like other priorities, but it makes me extra thankful that you're here to like kind of like provide this information that maybe they wouldn't get like otherwise. I love how you explain the different type of like erections and what can elicit them. Is there any like adaptive technology that can also come into play in helping with like sexual intimacy after spinal cord injury?
So, as far as adaptive technology, I'm not entirely sure about that, but I will say that there's other things that I do not recommend, but I do just kind of discuss with my patients as far as there's options, and these are options, right, that are out there. There's constriction bands, and that's to obviously maintain their erection. There's it's a vacuum erection device, so it's typically you can get that at one of those shops, those intimacy shops. Medications, suppositories. There's penile injection therapy. There's also surgical implant prosthesis. And as well as there is vibrators as well. And there's regular vibrators, and I just kind of tell them, hey, I would experiment with this as far as, different sensations and where we're feeling. But I would also, prior to telling them about, the medical grade ones, because there are some ones that are actually specific to this that they can purchase. I do not believe that it's covered by insurance, at least for a couple of my patients that I've seen. And then there's also wedges as far as for positioning to just kind of increase more of like that hip thrust and just to kind of avoid any like AD complications that would be happening if you are experimenting with the act.
And what does that look like for females?
So for females, I haven't had a huge knowledge base right on it because I have worked a lot with males, but I do know that there is more changes in lubrication. So it's not as easy as before. So, and there is a little bit of decreased sensation. Not a little bit. There can be, it can range, right, as far as for sensation goes. But I will say that with the research that I have done, that doesn't mean that just because you do have sexual intercourse with your partner that you should not, let's say you're partaking in the act and let's say one time it's not you're not feeling as much, there's not as much sensation down there. I've read that it does not mean that you should not keep trying, because having an orgasm and reaching that can still be achieved. It's just a matter of, exactly what we practice in, for muscle activation, right? It's just kind of increasing more of those signals to the brain. So the more that you attempt to do it, the more that possibly that will return.
I love that. Is this like knowledge in regards to like specifically the topic of like sexual relationships after spinal cord injury, is that something that you were taught in school, or did you do kind of like some research on the side once you began practicing?
No, actually, I think that the extent of my knowledge in school was, this is within our scope. We can target positioning and just giving modifications and adaptations to when they are performing the act, how to increase their performance or to make it a little bit easier. And that's really it. Now, as far as the research that I've done on the side, I attended one of those SER seminars, as well as research a lot because I enjoy learning about it so much. And I have found that it really has helped, and it's also helped my rapport with my patients. I feel like they're like super, if they are exploring any of those things, they're like, hey, listen, we did this and this and this. And, sometimes it may be too detailed, but it's okay. It's just the level that we're on, right? But, which I appreciate. So, I think that the amount of research that I've done on the side has definitely been worth it.
I like that. Do you have any advices for like occupational therapists that, let's start one with like new grads occupational therapists interested in the outpatient settings. So things, outpatient neuro in particular, like things that like I think you think could help, or like, resources for them to like maybe be more comfortable in that setting.
Yes. So I would recommend all of our new grads / my students. I always tell them, I think reading up big time on spinal cord injury, because you're touched on some of the things, but and I think this is across all disciplines. It's one of our it's could be one of the most challenging things, right, to develop some interventions and to be a little bit creative. But I would say, if this is something that you truly, truly are interested in as far as outpatient, um, really immersing yourself in, I hate to say this, but social media really helps. I think that, a lot of my knowledge based off of interventions has been from, okay, I know what I want to target here, right?
Mm-hmm.
And now let me see, um, let me go and explore, right? And I think that sometimes it's even places, out of the country that you're sitting there and you're looking at certain things that they're using, right? Where they might not even have any of the tools at all that we have,
Mm-hmm.
but they're able to, get them either in quadruped, right? And this may be a really dependent patient. Um, and so I think that by using those resources can really help. I think that by thinking outside of the box really helps as well. Don't just box yourself into, this OT scope where we're just, sitting and we don't get our patients standing, right? Because I
Yes,
think
yes.
super extremely important. I think that that's, full scope is, I mean, that is, I love that. And that's how I treat. And I think that a lot of, the other therapists that I've worked with at Spero, that's how they have been. Don't be afraid. It may be intimidating at first, right? I have a very small stature, and I am working with patients that are way bigger than me, and I try and I figure it out, right? We have a great group of coworkers and staff and techs that help us achieve those different positions. So hey, I would say if this is, something that you want to do and you want to put your mind to, you can do it. So
Love it. What about any advices for like working moms? So I think another big part of your life, which you mentioned at the beginning, is like raising a whole kiddo, being married and working full time. Maybe any advices for clinicians struggling to kind of like find that work-life balance? Like what are some things that help you make it all work?
I mean, I'm sure I'm still trying to figure that out, but no, I think that for me, what really works is I am huge in routine. I definitely, I think that being a mom has definitely helped me grow as a person, right? I think that, knowing whatever time he wakes up or whatever time he possibly could, I think that by me taking that time prior, even if it means me waking up a little bit early, just to like have my time to just digress and chill a little bit, have my coffee. Some people think it's crazy that I do it, but it works out for me. And it really provides me structure in that routine, right? I also think that it really helps being a part of a company that is flexible enough to work with, yes, super flexible enough to, hey, you want to be home for dinner and you want to do this, that is extremely important and I will work with you. So um I think that whenever I get home too, I'm very much like, hey, I know that by the hours of 5 o'clock to 7:30, that's like all devoted to my kiddo. And then afterwards, if it means me doing paperwork or whatever it means, I'm completely okay with doing that just so I can kind of spend time with my family.
Oh, I love it. I think it's like as a coworker, it's very inspiring to see like how you organize your time and how you manage to do all the things because like Megan, you're amazing. You're amazing. And
Thank
so like
you.
I like how you mentioned routine. I think that's like a really, really, really good tip.
Yeah.
And then last advice would be any advice for people trying to find careers, like specifically in outpatient neuro, like for you, like how was that employment journey and like networking or
Wow.
like finding even like that first job?
So I got super lucky with that because I'm probably the worst person to give advice for this. No, but I think honestly, I'll say for myself, okay. So I was a tech at Spero prior to getting an OT. I also was a tech prior to the whenever I first graduated, I was a tech at a pediatric clinic, right? And um, they were the clinic that I worked as a tech prior to Spero. So I think for me, I would say really keeping those connections are extremely important. I think that this therapy world, it's large, but it's also so small. And everyone knows everyone, and or you're able just to kind of network with other individuals. I think that, again, I'm gonna just kind of relate it back to social media, right? I think that thanks to you, right, our social media platform has grown so much and everyone knows a lot about Spero, right? And I think that by you, if you are a student and you're really interested in outpatient neuro, I think that you, hey, reaching out and just contacting by email to whatever clinic it is that you're interested in and just kind of putting yourself out there is super important, because if it's what you're truly interested in, there's not that many outpatient neuro clinics out there. And so if you can get your foot in at some time at some place, whether it be, maybe you're not interested in it right after, but my goodness, if it's something that you think about, years down the road, maybe whenever, you're settled and you have your family, then hey, I mean, I think that just reaching out, and you never know.
I like that. I like the networking and then the reaching out.
Yes.
Uh,
Yes, yes.
yes, it's very important. Where can people find you? So either whether you're comfortable sharing your social media handle or like an email address.
Oh, okay. Yeah, so, let me think about what my Instagram handle is. I believe it is Maegan, Maegan _Brittany, Brittany. And or definitely feel free, to contact via email about anything that I've discussed. M and then Barin, Barin @SperoRehab.com.
Awesome. Thank you so much, Maegan, for your time and for your expertise. Such an amazing conversation.